The British Medical Association is reporting that NHS consultants are ready to strike after a consultative ballot showed support for strike action. So they've consulted the consultants. The association warned that it will proceed to a formal ballot unless the government takes action to meet the pay demands by the 3rd of April. So what could an NHS consultant strike actually mean for our health service? And do they really have the right to strike, given the fact that they earn an average, according to reports, of around £120,000 a year? With me now is Dr Mike Barnes, who is a consultant neurologist. Thank you very much, Dr Mike. Do you think the consultants have the right to strike? They sound quite rich.
Pleasure.
Should they strike?
Yeah, I don't think the actual level of income is relevant to striking. I think this country has fought for the right to strike over 100+ years, and I think it's important for any group to have the right to strike. Right. Now, I realise that most strikes are about low-paid workers, but of course they are, and probably in the community there's probably less sympathy for higher-paid workers, but they can be equally aggrieved about their terms and conditions of service, their pension rights, and I think they deserve a right to strike.
OK, I'm just looking at an article here in the Telegraph which says that NHS consultants were paid around £1 million for their work during test and trace. So the idea may be that they suffered at the hands of the coronavirus crisis, which is being used, of course, by people like paramedics and nurses who are much lower down the pay scale than consultants. Possibly doesn't stack up for consultants. So what's so bad about the pay?
Well, I think this, it's not a strike as yet. It's a consultation that might lead to a strike if the government doesn't listen. But it's not just about pay. It is about pay. But the two other main issues that I think the country ought to be worried about is the pension, to start with. There's many consultants now in their 50s who find it much more financially attractive for them to go part-time or simply retire. The level of people leaving the NHS at consultant level has tripled since 2008. Now, that's got to be worrying for the country because we're losing good quality consultants who are at the peak of their abilities and they're drifting off either to retire or into the private sector unnecessarily because of the pension difficulties they're facing. The government can do something about that. They did that for judges. They can do it for doctors. So it's not just about pay. What is
the pension?
The pension varies according to how much you've been paid over the course of your working life. So, again, it can be generous. But the point I'm making is that consultants are leaving at a time when the NHS needs more consultants. Many are leaving because of the ridiculous situation with their pensions. We all know that at the moment there's a real crisis in the NHS. Look at the striking nurses, the striking ambulance drivers. We need to keep people in NHS when there's a huge need for those doctors to be there. We need them to stay. And in my view, the pension is one reason they're leaving, so let's put the pension right so they can stay and help people in NHS. The other thing is that the doctors always, and other groups, were always subject to independent pay review. That was an independent body who sat down and said, what is a fair rate of pay for this group? That was fine. Everyone accepted that. But now, recently, the government has been interfering with those recommendations, and I think all the doctors want is the review of the pension and review of the independent pay body.
Are they holding at a time when nurses, paramedics, ambulance drivers, NHS call handlers who maybe earn an average of around 30 grand a year are going on strike because they are, in some cases, saying that they are struggling between heating and eating? I am relatively sceptical about the old food banks argument, but that keeps being made about them going to food banks, etc. With respect, consultants are not feeling the pinch when it comes to the cost of living crisis in anything like the nurses that our TV viewers will be able to see on picket lines there. And, surely, if they cared that much about the NHS, they would actually maybe even forego a pay rise and give that to nurses, wouldn't they?
I think I understand that argument entirely, and I have great sympathy with it. But nevertheless, at a time when the NHS is clearly in crisis, and that's unarguable, we need to keep the good senior doctors.
So they're holding patients to ransom, Dr Mike, are they? This is the thing that I find it difficult to get. If the NHS wasn't in crisis now, would consultants really be asking for a pay rise and a better pension? No, is the answer. And they are doing it because they see a window of opportunity. And is that not bad for patients' care?
Well, if that was true, it would be bad for patients' care. I would like to differ that they're not taking advantage of the timing. I mean, look at all the staff, ambulance staff, nursing staff, junior doctors as well, we shouldn't forget, are all reflecting the fact that the NHS is a bit of a poor shape at the moment and they need to do something about it. I don't think, generally speaking, the doctors are taking advantage of the situation.
All right. Would you be going on strike, Dr. Mike?
No, because I've retired.
Oh, fair enough. That would make a lot of sense. Yeah, we might need you back in. There you go. Look, thank you very much.